Hi, I'm Marvin, and welcome back to another Workflow Wednesday. And in this Workflow Wednesday, I'm going to be showing you guys how to make two separate surgical guides on a single treatment plan on RealGuide. So right now, I have RealGuide open, and as you see, I have two different implants planned. I have one for site 19 and one for site 30. So what we're going to do is we're going to go ahead and make two separate guides off of this treatment plan. So this is a good tool to know so you don't feel like you have to make two different separate treatment plans. Of course, I know this is all on one single jaw, but some doctors might only want quadrant guides. Another thing that this can actually be useful for is to save material on your printer rather than making a full arch guide. You can go ahead and make two quadrant ones that will take less material and actually would be more efficient when it comes to speed on if you need to print them out, let's say same day or anything like that. But without having to go back and make different treatment plans, we can just go ahead and select which ones we want to make in the actual guide making software process of this. So what we're going to do now is we're going to go to the left and we're going to go to the guide design. And here, of course, just like any other surgical guide we're going to make, we're going to go ahead and identify the undercuts. So, of course, there's no problem seating the guides at time of surgery. So the best way to find these undercuts is go ahead and just look at this from an occlusal view. And once you have the occlusal view, just go ahead and bring the model and lean it forward until you see that tissue in the front just like that. And then what you can do on the left side is set the insert direction from the view. So just like that, you'll notice this little arrow moved, which is a representation of your actual undercut and how you're going to do it. So for example, if you wanted to move it even just a little bit, you can obviously hover over it. And as you see, you can left click, hold, and move it manually. But I do use this tool because it's a very efficient way to actually get the undercuts, and especially using it from that viewpoint. Once you've gone ahead and done that, just go ahead and press Generate Undercut. As you can see on the left side, there are different parameters that you can go ahead and change. These are all preset by RealGuide, and realistically, you want to keep them the same. If you do have any problems in the future moving forward with any of your guides and you're starting to notice things aren't fitting that well or there's just some problems, you could come back here and not only move the parameters, but you could actually identify the undercuts manually. But for me, I've done a lot of guides now on RealGuide, and it works very well just identifying that undercut from the occlusal view and then moving forward. So like I said, we made our undercut model as we see here, just like this. So we've made the undercut model, and now we can go ahead and we can move forward to the next step. And now as you see here, looking at our occlusal view, we actually see that there's two numbers here in representation of where we place those implants. We have one for site number 19 and we have one for site number 30. So of course right now the software identifies that we want to make two implant sites, on one guide. But we don't want to do that for this case. What we actually want to do is we want to make two separate guides, one for one implant site and one for the other. So what we're going to do is very simply, all you're going to do is unselect the one that you don't want to be incorporated into your surgical guide. So for example, for us, we are going to left click on number 30, just hover over it, and you'll see once you left click, it is not highlighted green anymore, it is now white. That means you are pretty much letting the software know you are not going to be incorporating this site into your surgical guide. Once you go ahead and unclick that, now you can go ahead in this phase and draw your border in which how you want your guide to sit on this patient's teeth. So of course, this is just going to be a quadrant guide. So we just need to come halfway. I'm just left clicking and creating this new dot. The dot is connecting from the last one to the new one that I'm placing. And we're just going through and we're creating this outline of how we want the guide to sit. Coming back to that last original dot that we started with, and you'll see there's a little bit of a space here. Just go ahead and grab that last dot by left clicking when it's highlighted green, drag it over, and it will connect just like that. Once you've gone ahead and you've done that, you can go ahead to the right, or to the left, and press Create Guide. And just kind of like the undercuts on the left side, we do have all these different parameters that are set. These are, again, all preset at a very diameters and parameters that we need for these surgical guides. If for whatever reason you feel these guides are coming out too thick, too thin, you can definitely come here and switch the parameters that you have here. But I do keep mine, especially for the thickness. For the occlusal thickness, I do keep it at 3.5, and the parameter thickness, I do keep it at 3 millimeters. If you want to change that at all, you do have the option to, but I would just probably keep it there. But once you've gone ahead and you've done that, you'll see we have our guide made. But what we want to do before moving forward is, of course, adding viewing windows so the doctors can see that it is sitting properly on the patient's jaw, and also adding some sort of identifier, whether it's a PAN number or the patient's name, so that if you're creating multiple of these inside your office or your laboratory, you have an easier way to identify in what case this goes into. So we're going to go to the left, and where it says advanced options, you're going to have where it says round window. If you hover over, you'll see that there is this green dot. So that is a representation of the window. So if I left click and put the dot, there it is. That's our window. But of course, we're going to want a wider window than that. So we're going to undo what we just did. We're going to come over here to where it says window depth and window size. I do keep the depth at 20.0 because you don't want it to go too down low to where you're taking away material, but you do want the size to be brought up. So let's go from 5 to, let's try 11 might look pretty good. So all we're going to do is I usually put it so whatever direction you are looking at the guide, that's where the window itself is going to go. So I like to look at it from an occlusal view, follow that arch kind of like this of the mouth, left click, and create a window just like that. So you see how this created a very thin piece of material. So we might have to go back and change that depth from 20 because maybe obviously this is not enough material. We don't want this to lose strength right there because that's where we're creating the window. So we can come back here, we will undo. We can bring that depth down from 20 to, let's say about right there, 14. Left click again, and create that and create more material there just so we're not altering the strength of the guide itself because we don't want that to break at time of surgery, especially that this is a quadrant guide. We break too much off, it will cause for seating to not be exactly perfect. So that should still be good enough material to keep there. And now what we're gonna do is we're gonna go ahead and we're gonna add a text option. So again, this is more for you on how you want to identify where this case goes. For example, in our laboratory, we have pans that have distinctive numbers that are on them. So what we will do is we will add that number to whatever case we're doing. So once this is printed, we know where it goes. And of course, we want to make sure we keep everything organized. So if this is going to be a number, if this is going to be a patient's initials, a patient's full name, you can definitely add whatever you want. So for example, for me, let's say that the number is 222. We can go ahead and add that. Hover over, and as you see, this is pretty big. We want to bring that size down. So we're going to go ahead and we're going to go to the size, and we're just going to bring that down a little bit. Hover over again. Let's bring that down. Another thing that you can actually see too is that there's a lot of space in between each one of those numbers. So you will see that there's actually one for spacing. Go ahead and bring that down too. You don't need the number spaced too far like that. Maybe something like this. Maybe this is even too much space. Go ahead and bring that down just a little bit. And just like that. So all you're going to do is left click, just like that, and have it sit there. Again, if you want to add multiple, you want to add the patient's number, and you want to add the patient's initials, and you want to add the patient's zodiac sign, whatever you want to put, you can go ahead and add that very easily right there. So all you're going to do is go ahead and press next. And also too, before I move forward, there is an option here that you see, it says engrave. So you can actually have this be engraved or kind of have it pushing out like a 3D text that you see here. I like to engrave just so it's not going to cause any complications in the actual seating or anything, but just so it maybe doesn't bug the patient at time of surgery. So I do keep it on engraved, and then I will go next step. And just like that, as you see here, we have our guide for number 19. But as we said in the very beginning of this video, this is for 2 separate guides. So we do have to go back and we have to make the other one. But what I like to do before doing that is on our object list right here, I find that surgical guide, I come to these 3 lines that are right here, and you can rename it. And I'll have it named surgical guide, and in parentheses, I'll put, for example, number 19, because that is the guide that we made. So we're going to go ahead and be able to do that, because when exporting, it'll be an easy way to identify which is which in your files. Of course, you can double click it and look at it in like a 3-shape model viewer or in a mesh mixer, and you can identify it that way. But to keep things simple and keep things easier for you, definitely change the name on here just so you can identify which is which when you're exporting. So now we're going to do the same thing. We're going to come back to guide design. And as you see here, when you do it, it's going to ask you a question. A surgical guide already exists. Did you want to create a new one? Did you want to edit the existing one, or do you just want to cancel? We want to create a new guide, but it's not going to get rid of the other one, but we are creating a new guide. So we're going to go ahead to create new guide. And pretty much like we did before, you're going to go through the same steps. You're going to create your undercut model. Again, looking at it from an occlusal view, bringing it forward until you see that tissue. And now set the insert direction from view and go ahead and generate the undercut. Going to the next step, very important, we did make the guide for number 19, so we unclicked 30. We're going to do the opposite now. We are going to unclick 19 and make sure 30 is still highlighted green. Of course, again, like I said, all the parameters and everything will stay the same. Now you can go ahead like we did on the last one, left click and start your dots and create your line that represents the border in which this surgical guide is going to sit. Coming just halfway to the quadrant, coming back down through the other side. And again, just reaching that dot that we started with. Once you have it there, grab your last two, whichever one you want, bring it over by left clicking and holding and connect it. And just like that, we're going to go ahead and create the guide. And then, of course, same process as before. Because you've done this once already, this should be very easy for you to just move forward, and we're going to add our windows. So round window, hover over where you want it. Of course, double check that you didn't take too much material away. If you need to edit it at all, don't forget you have your window depth and size that you can do. And of course, we're going to go ahead and add our text option again because we want to identify these. Even if you wanted to, you could actually put the pan number and in parentheses the actual implant. We don't need to do that. We'll be able to differentiate it when we look at them and see what way the arch is going. So we're going to go ahead and put the number again. Go ahead and go next step. And now, as you see here, we have our two surgical guides. We have this one for number 30, and if I bring it up, this one for number 19. I'm going to, again, come here, rename this surgical guide, put a parentheses just for 30 that I know that's the one. And now, of course, right when you make those surgical guides, you will be in the reports and export data. You can come here and export guide and model. You can export guide for milling, or you can just, of course, export all. It will export everything. You might have to delete some things because it does export a little bit of extra objects that you do have in, but it will, of course, export those surgical guides. That's it for another Workflow Wednesday. We'll see you guys on the next one. For any questions, please comment below.